All right, let's talk about that pain. You know the one, that nagging, sharp pain right on the outside of your hip. The kind that wakes you up when you roll over at night or screams at you when you try to get out of a chair. It is an incredibly common problem. But you know what? The real reason it's happening? Well, it's probably not what you think.
So you're dealing with this pain, and you're asking yourself this exact question. It is so frustrating. It can stop you from doing the things you love. And for a really long time, the medical world had what seemed like a pretty simple answer.
Yep, I'm willing to bet if you've seen a doctor or even just Googled side hip pain, you've seen this term, trochanteric bursitis. For decades, this was the go-to diagnosis. The whole idea was pretty straightforward. There's this little thing in your hip, and it's inflamed.
And that's what a bursa is. It's basically a tiny, fluid-filled pillow. Your body has them everywhere, and their whole job is to help your muscles and tendons glide smoothly over your bones. So the old theory was that the bursa on the outside of your hip was just getting angry and inflamed, and that was causing all the pain. Makes sense, right? Well, what if I told you that simple story is, for most people, just wrong? Thanks to modern science and imaging, we've learned that the story of hip pain has a major plot twist. And, spoiler alert, the bursa is not the villain here. That's right, that classic diagnosis that we've all heard, it's being completely overturned by a mountain of evidence. We're finding that, most of the time, the bursa is just an innocent bystander, getting blamed for a crime it didn't commit.
And here you have it, straight from some of the leading researchers in this field. The real problem, what we now call Greater Trochanteric Pain Syndrome, or GTPS, isn't bursitis, it's tendinopathy. And that opathy at the end is super important. It doesn't just mean inflammation, like itis does. It means the tendon itself is unhealthy, damaged, and struggling. And look at this. The proof is right here in the pictures. When scientists started using MRIs and ultrasounds on people with this exact pain, the results were just staggering. A whopping 80% of them showed signs of damage to their gluteal tendons. And actual, true bursitis, it only showed up in about 20% of cases. The evidence is just overwhelming. The tendons are the real victims.
So here's the bottom line. If your bursa is inflamed, it's almost always because the unhealthy tendon right next to it is irritating it. The bursitis is a symptom, a side effect, not the root cause. Focusing on the bursitis is like furiously mopping the floor while ignoring the leaky pipe in the ceiling.
Okay, so if the problem is the tendons, what's actually going wrong? Why are they getting so beat up? Well, it's a story about bad mechanics and a constant daily squeeze. So first, let's just get our bearings. You've got your glute muscles on the side of your hip, and they have tendons that come down and attach right to that big bony knob you can feel on the side. That's called the greater trochanter. Now, layered right on top of those important tendons is this huge, tough strap of tissue called the IT band. Just picture a thick, leathery belt running from your hip all the way down the outside of your thigh. And this, right here, is the moment it all goes wrong. Every single time your leg moves across the center of your body, a movement we call adduction, that tough IT band pulls tight and it literally mashes those gluteal tendons down against the hard bone underneath. It's like pressing a rope against a sharp rock over and over and over again. And we're not talking about a little bit of pressure here. Scientists have actually measured this stuff. Just moving your leg inward by 40 degrees creates over 100 newtons of force. To put that in perspective, that is 25 times more pressure than when you're just standing normally. Now imagine doing that thousands of times every single day. So, you see, this new understanding of compression completely flips the script on how we treat this. And the first step isn't about what you need to start doing, it's about what you absolutely have to stop doing. And this is maybe the biggest mindbender of all. For years, what did everyone tell you to do? Stretch your glutes, stretch your IT band. But think about how you do those stretches. You pull your leg across your body, right? You are literally putting the tendon into that exact position of maximum compression that's causing all the damage in the first place. The new science is crystal clear. Stop stretching it. You're just making things worse. So here are the 3 big culprits you need to shut down starting today. Number 1, stop sitting with your legs crossed. Number 2, stop standing with all your weight sunk into one hip, letting the other one drop. You know that pose?
And number 3, if you sleep on your side, you have to put a thick pillow between your knees to keep that top leg from dropping down and compressing the tendon all night long. These little changes are huge. Okay, so we've stopped poking the bear. We've taken away the things that are constantly irritating the tendon. What's next? Now we have to go on the offensive. It's time to make that tendon strong and resilient so it can handle the forces of everyday life without getting painful again. A modern science-backed recovery plan looks just like this. Step 1, we just covered it. Reduce that compression. Stop doing the things that hurt. Step 2 is starting some gentle isometrics. That's just a fancy way of saying you gently squeeze your glute muscles without actually moving your leg, and you hold it for about 30 to 45 seconds. It's amazing for pain relief. And finally, step 3, you slowly and carefully start to add heavy, slow strengthening exercises to rebuild the tendon and make it bulletproof. Now, changing your habits and doing the right exercises, that is the absolute cornerstone of getting better. But they're not the only tools in the toolbox. So let's quickly touch on some of the other common treatments and see where they fit in this new picture. You've probably heard of cortisone shots, right? They can be fantastic for knocking down severe pain in the short term, but remember, they don't do anything to fix the weak tendon. Shockwave therapy has some really good evidence, especially for stubborn cases. Things like ice or anti-inflammatory pills can help when things are really flared up, but they're a temporary band-aid. And surgery? That is an absolute last resort for a tiny fraction of people with big tendon tears who haven't had gutter after months and months of proper rehab. So you see, it all comes back to this one central idea. All those other treatments can help manage the symptoms, but real, lasting recovery only happens when you fix the root cause. You have to stop compressing the tendon, and you have to start making it stronger. You have to fix the faulty mechanics. And really, that's the question I want to leave you with. Understanding this massive shift from blaming a simple bursa to understanding a complex problem of tendon compression is everything. It completely changes the game. So I want you to ask yourself, is your current approach just chasing symptoms, or are you ready to finally fix the real cause?